It's really stunning, Mr. President. I'll tell you, it seemed like for a period of time, and Dr. Wen, you can share your experiences, that pain relief was talked about a lot, but only in the context of giving out drugs. The literature would all suggest, if you looked back at those small reports, that there was no concern for addiction, and every single time someone came into an emergency room, even for a non-pain related thing, they would be asked about pain and perhaps given narcotics. 80% of the world's pain pills are consumed in the United States. We are 5% of the world's population. We take 80% of the world's pain pills. We don't have 80% of the world's pain, my guess. What do you think, Dr. Wen? How did that happen?
I think two things happened. One is that drug companies very aggressively, and I don't know if it's knowingly or not, but they misled and marketed pain pills to physicians and patients. And we then developed this culture also of a pill for every pain. If I fall down, I bruise my knee, I may not need opioids. I'm sure I do not need opioids. But somehow we have said that our goal is to make people pain-free. And so, I've worked with many great doctors. I trained with many fantastic people, including Dr. Murthy, our Surgeon General. And I know that doctors are trying to do the right thing. We're not trying to get our patients addicted to medications. We're not trying to get them to switch to heroin later. We need the resources to help us to then support us, whether they are the guidelines as issued by the CDC, or whether they are other efforts by our medical societies to assist us to make better decisions for our patients. But we also need our patients, and we need society to change too. Because if I talk to one of our students in Baltimore City and I ask them, is heroin good or bad? They're going to say heroin is bad. But if they see that every time that they're acting out in class, that they get diagnosed with attention deficit disorder and they get a pill, or they see that their parents are in pain for maybe they sprained their back and they see their parents getting a whole month's supply of oxycodone. I mean, this is the culture of excess that has to change.
That's a great point.
I think it's a great point. Sanjay, that's what I mean about us reimagining how we think about health and wellness.